Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 67 of the Ask Dr. Angela podcast. So we are getting nailed by the snowstorm. I am so happy that I am not on call this weekend. I mean, honestly, if I was, I would have to just spend the entire weekend at the hospital, which I am not a fan of. I hate being at the hospital, sleeping at the hospital. I'm that doctor that does not mind burning the gas, going back and forth between my house and the hospital. I like the comforts of my own home. I like the comfort of my own bed. It is really, really, really yucky outside. My little one has not yet woken up, and so she has not yet seen this winter wonderland, and I'm really happy because shortly after she wakes up, I know she's going to want to go outside and build snowmen, igloos, and snow angels. I'm telling you, we have so much snow out there that, first of all, it's right up to the level of my knee, and I'm 5'3", so my mini-me, if she goes out there, it's going to be at least to her waist, probably right underneath her armpits. But if we try to make snow angels, we're going to be buried in snow. I mean, there's just no other way to say it. It's that much snow. I got a full body workout just taking the dog outside. I mean, it literally was monstrous trying to lift one leg and put it in front of the other as we tried to find a spot for my dog to use the bathroom. And let's not even talk about my dog. The snow was like all the way up his arms and legs, covering his belly. Just craziness. But anyway, let's get to today's topic, which is post-term pregnancy. Now, this is really interesting because I'm going to say that not everyone really understands what post-term pregnancy means. A lot of you confuse post-dates pregnancy with post-term pregnancy. Post-dates pregnancy just means you went beyond your due date. And that's not nearly as big a deal as most people make it out to be. Post-term pregnancy, however, is a pregnancy that gets to 42 weeks or beyond. Now, what I'm just going to say right off the bat is that no one allows a pregnancy to go beyond 42 weeks, at least not in my practice. That constitutes a post-term pregnancy, and there certainly are risks that are associated with the post-term pregnancy. Things such as the placenta not working as well as it did earlier in the pregnancy. So the baby has decreased oxygenating capacity, decreased amniotic fluid volumes, which can translate into labor abnormalities, likely secondary to umbilical cord compression because there's not a lot of fluid around baby any longer. Risks for the baby are going to include things like increased risk of dysmaturity syndrome. And you all know what this is. This is when the baby comes out looking long and lean, looking like old people with a really alert face, lots of hair, long fingernails, thin wrinkled skin, just kind of malnourished. There's going to be an increased risk for cesarean section in those patients that have post-term pregnancies. There's increased risk of macrosomia, or the baby being really large. And one of the biggest risks is meconium aspiration syndrome. There's an increased risk of baby having a bowel movement in utero, and certainly an increased risk of baby ingesting or swallowing some of that. And the big deal with that is that can lead to an increased risk of admissions for babies into the NICU or neonatal intensive care unit. So in my practice, once folks go beyond their due date, i.e. 40 weeks, we typically implement some sort of antepartum testing. That can be anything from a non-stress test, which is where we hook you up to some monitors. You stay connected for 20 to 30 minutes, and we're looking for reassuring fetal heart tracing and status. We can also do something called a biophysical profile, which is an ultrasound that looks at the amount of amniotic fluid surrounding baby's movement, breathing, and tone. In my practice, if we do implement this antepartum testing and it's reassuring, then you can continue to be pregnant. If, however, and again, this is just my practice, but if you happen to get to 41 weeks in my practice and you haven't delivered, we do pick a date for induction. And I think we already covered induction in previous podcasts, so you can refer to that. It's very commonplace to induce a patient if they've gone 1 or 2 weeks beyond their due date. It just so happens that in my practice, it's 1 week. So I hope that this has answered some of your questions, because this is a pretty hot topic. I hope that today's podcast has helped somebody, because, this is all about helping somebody. So anyway, thank you for tuning into today's podcast. If you have a topic or question that you would like featured on the Ask Dr. Angela podcast, just go to www.askdrangela.com. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. You can email me a question. You can tweet me a question. You can direct message me on Facebook. You guys are sending them from all over. If we use it, we will send you one of our bomb-ass t-shirts. Someone from my team will reach out to you and we'll get that in the mail straight away to you. I just recently shipped another t-shirt to the Philippines as well as to India. So this podcast is reaching people worldwide, and I am loving it. So let me leave you with this. If you get up one more time than you fall, you will make it through. It's funny because I always tell folks that know me or that are getting to know me, of all of my siblings, I am not the most naturally intellectually gifted. I just try, and try again. And that's what you got to do. You got to persevere, pick yourself up, and keep it moving. So until next time, look better, feel better, be better. Looking forward to reconnecting on episode 68.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.